Same with the gyri, we see a number of prominent sulci. These are less relevant, but just so for completeness, we'll point out that the sulci that are most relevant are the central fissure, which is the sulcus, the valley, the cleft that separates the frontal and the parietal lobe, and the lateral occipital gyrus, which is here, connects with the parieto-occipital sulcus that tells us that this is the point that separates the parietal and the occipital lobes. There's not very much else to say apart from the lateral fissure here, which is the cleft between the temporal lobe, shown here at the bottom, and the frontal lobe. It is important to point out that you can't imagine from this image the three-dimensional nature of this, but if we were to pull back the front of the temporal pole and drag it to the front of us and look inside the lateral fissure, then we would see a good deal of frontal cortex buried beneath. So imagine that, lift out the temporal lobe and look beneath the temporal lobe, we would see that the frontal lobe extends quite a long way, but is obscured from view because of the temporal lobe which sits on top of it in this particular view. So it's important to bear in mind that the frontal lobe and the temporal lobe are co-located, but critically they do not make direct contact. So the lateral fissure, which is a valley, a cleft, which literally separates the two lobes, one from the other, disallows any direct contact between the two lobes, which makes them physically distinct. But because the frontal and temporal lobes are co-located, so they sit next to each other, what tends to happen is that if the blood supply is disrupted, because the blood supply doesn't respect any boundary according to the lobar. So the blood supply is not specifically feeding just the frontal lobe or just the temporal lobe. The blood supply, particularly the internal carotid here, and the middle cerebral artery, MCA, this arterial system is vital for both the health of the temporal lobe and the frontal lobe. So damage to the middle cerebral artery at any point along its journey will inevitably cause impairment not just to the temporal lobe but also to the frontal lobe. The function of both lobes will be affected with a stroke in the middle cerebral artery, even though the frontal and temporal lobes are not connected to one another through the structure of the brain. They are connected to one another because of the arterial system, the common arterial system, which connects them by virtue of the arrangement of the arteries, but it's not the function of the frontal lobe and the temporal lobe that is connected. It's simply the nourishment of the temporal and frontal lobes which make them necessarily coexist. This co-location by virtue of the arteries means that when we get a stroke in the middle cerebral artery territory, in other words a blockage to the middle cerebral artery blood supply, we lose both function in the superior temporal region, the superior temporal gyrus, and also in the inferior frontal lobe. That is important because in that particular instance we'll see damage to the language processing of a patient with left hemisphere stroke. That means we see both impairment to the comprehension of speech, which is the function of the superior temporal lobe. This is comprehension. And we'll see some problems with speech production, which is the function of the frontal lobe. So in other words, because of the arrangement of the arterial system and the fact that it provides nourishment to both the superior temporal lobe and the inferior frontal lobe, damage to that artery will lead to loss of function in both of those lobes, giving a correlation between speech production and speech comprehension impairment that will necessarily produce a type of disorder that we call mixed or global aphasia. And that means that it's not only speech production or speech comprehension that is impaired, but both. Both functions, speech production and speech comprehension, will be reduced because of loss of blood supply to two physically distinct but correlated regions of the left hemisphere.